This is what we call a basic low back exercise routine. These are some exercises that I give often very early in a low back rehabilitation. The exercises are designed partly to maintain the mobility in the lower back and also to work the core strength muscles. So Chad, lying on the floor, not to be done on the bed, lying on the floor on your back. A little bit of support for your head's a good idea, and we want your legs just off straight, so just in a slightly bent position. The straighter they are, the more you're going to work. So drawing one knee up into your chest and grasping under the knee, so we're not squashing the knee, drawing it up and down, just nice and slowly, so we're working those ab muscles at the same time. Other knee, same thing. Drawing it up. Now just remember not to grasp over the top of the knee because that risks injuring your knee. So just grasping under your knee, squeezing nice and tight and down, and then we'll do both together. Same sort of action. Both up and drawing your knees in nice and close to your chest so that you're feeling a stretch in your lower back. So we're going to repeat that, one leg and then the other leg and then both legs, and we're going to do that about 10 reps. Again, we want to do it nice and slowly so that we are working those ab muscles while we're doing it. After you've done 10 of those, we'll move on to the next exercise, which is the same starting position. So just get those knees just off straight, just slightly bent, and we're going to push the small of the back down flat into the floor. So just tilting the pelvis and flattening down the back. Now, if you haven't done this before, it can take a little bit of practice. What you can do is put your hands underneath your back and squash your hands. Squash your hands down. Now we're going to hold this for 10 seconds. So just count slowly to 10. The idea is to just use your pelvis and lower back and your abdominal muscles. We don't want to work the top part of the body. So down for the count of 10, relax it off, down for 10, relax it off. We'll just do 4 or 5 of these, and then we're going to go back through the whole procedure a second time. So 2 sets of each exercise.